Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 11, 2025. This video is on a JACC paper titled Trade-off between bleeding and ischemic events from LVAD devices, a EUROMACS registry analysis, and an accompanying editorial titled The Moving Target of LVAD Anticoagulation, a Call for Action. LVADs prolong life in end-stage heart failure, but the risk of hemocompatibility-related adverse events, HRAEs, including bleeding and ischemia, HeartMate 3, a magnetically levitated centrifugal flow LVAD, lowers thrombotic events versus hardware, but bleeding remains common. Aries HM3 trial showed aspirin omission in HeartMate 3 reduced bleeding without increasing ischemic events. This study was a EUROMACS registry study conducted between 2011 to 23. Observational design: 4,320 patients, 2,232 had HeartMate 3s implanted, 2,088 had HVADs, median age 58, 83% male, follow-up median 1.8 years, maximum 2 years. First ischemic adverse events include stroke, pump thrombosis, and arterial thromboembolism. And first major non-surgical bleeding included intracranial and non-intracranial bleeding. And these were the endpoints of the study. Analysis: incidence per 100 patient years, Cox regression for mortality, and propensity matching. What did they find? HeartMate 3 versus HVAD. Ischemic events 2.9% in HeartMate 3 versus 15.3 in HVADs, p-value 0.001. Bleeding risk 11.8% with HeartMate 3 versus 18% in HVADs, p-value less than 0.001. Trade-off: bleeding is greater than ischemia in HeartMate 3, delta 8.9% versus HVAD delta 2.7%. Early peak 15 to 90 days, declines thereafter. Both ischemic and bleeding adverse events independently increase all-cause death. Hazard ratio for death in HeartMate 3 in ischemic is 4.07 and bleeding 2.66. Limitation of the study: it's observational. Antithrombotic strategies were not standardized. Only the first adverse events were considered, the bleeding and other events. Cumulative impact not assessed. Findings may not reflect post-Aries HeartMate 3 practice. Key takeaways: HeartMate 3 reduces hemocompatibility-related adverse events, but bleeding now dominates the risk profile. Standard VKA plus aspirin may be excessive in HeartMate 3. Personalized anticoagulation, example lower INR, DOACs, aspirin, omission, are urgently needed. The editorial discusses the findings of this study. It clearly emphasizes that applying the same anticoagulation protocols for HeartMate 3 and HVADs is outdated and risky. The editorial urges personalized anticoagulation, low-dose DOACs, EVAD, INR modulation, and biomarker-guided therapy. Unresolved is a twofold increase in ischemic hemocompatibility-related adverse events in HeartMate 3 after 1 year. Calls for new trials post 90 days to optimize therapy. Author calls for end of one-size-fits-all strategy, time to individualize based on patient device and phase. Eponyms related to LVADs: Michael DeBakey LVAD, first clinical use in the 1960s. He collaborated with NASA. Robert Jarvik, MD, Jarvik 7. It was a total artificial heart but paved the way for LVADs. Bud Frazier implanted 900 LVADs, led to the development of Jarvik and HeartMate systems. William Cohn, co-inventor of HeartMate 3 with magnetically levitated rotor key in Momentum 3 trial. George Noon, partner of DeBakey on early VADs and total artificial hearts. Daniel Timms, PhD, engineer and founder of Bavacor, developing a total artificial heart using centrifugal rotary pump design. you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.